Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Here we have a case with facial trauma. We can see superior boundary of the right orbit, lateral bony boundary and inferior bony boundary, and this is lamina peprici, the medial bony boundary. And here we can see this is optic nerve, superior rectus muscle, medial rectus, inferior rectus and lateral rectus muscles. Here we can compare lamina peprici. On this side we can see there is inward bowing and fracture of the lamina peprici. Here we can see this is floor of the right orbit, and there is fracture and downward herniation of the orbital content through the fractured floor of the left orbit. Now just compare orbital fat. This is normal orbital fat on this side, and here we see diffuse haziness and stranding around optic nerve and along rectus muscles all around the orbit, suggesting post-traumatic inflammatory changes. Similarly, we can compare temporalis muscle and soft tissue over it on right side with the left one. Here we see there is diffuse soft tissue edema on left side. This is axial CT examination, where we can see this is depressed fracture of the left frontal sinus with inflammatory changes. Diffuse scalp edema is also appreciated around frontal bone and over left temporalis muscle. Here we can see fracture of the lamina peprici, while diffuse haziness is noted in retrobarbal fat surrounding optic nerve and extraocular muscles. We can compare this with the contralateral side, medial rectus, optic nerve, lateral rectus and eyeball. Fat planes are neat and clean on this side, while preseptal soft tissue is sharp and normal. And here we can see diffuse inflammatory changes in left preseptal region and over left temporalis muscle. Medial rectus is diffusely swollen as well. Inflammatory changes are noted in sphenoid sinus and left ethmoid ear cells. Here we can see posterior fossa components, that is brainstem, cerebellum, vermis, fourth ventricle, temporal lobes, lateral and third ventricle, centrum, semiovary areas. All appears normal. So basically problem is on left side of the face with fractures involving orbital bony boundary. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.